know that lots of people are very interested in exploring whether to use various types of complementary and alternative therapies. There have been a number of studies that have been done that show that lots of patients with cancer do use them. It's important that we think about the difference between complementary and alternative therapies. So a complementary therapy is something that's designed to be used alongside mainstream medicine. And the idea of it is to help the person cope better with the treatment and with what's happening to them. So complementary therapies include things like massage and relaxation, as well as things like yoga and music therapy. And all of these type of therapies have actually been shown to help people cope better with their treatment and lower their levels of stress. So we're very happy if people want to explore some of these complementary therapies.
I gave myself Reiki, which is to me is a complementary method of treatment. It goes along with the medical conventional medicine to the extent that it can be very calming and very strengthening. It helps to heal.
6 o'clock in the morning, come in to the hospital, have my treatment and then go home. But then when I went home, I relaxed. My body told me I needed to relax a bit, and I listened to my body and had lots of water and looked after myself that way.
In the way I deal with my cancer, I always exercise. In the morning, I try to sit down and I calm my mind first.
Started on a low base but quietly built up and went to the gym and played the tennis and the golf and then started to go skiing again and doing the things that I love doing. And again, I think it's all part of positive thinking and saying, okay, well, we're not giving into this, let's get on with it and let's take it on. We can live a normal life. It's not a death sentence. We can beat this thing. And I think the exercise program is mentally very good as well as physically.
In contrast, alternative therapies are different. An alternative therapy is something that's designed to be used instead of a mainstream medicine. And they're often promoted by someone who's actually trying to sell a product. And I always warn people to be a bit suspicious of anyone that's trying to sell a product to them. And some of these alternative therapies are given in an invasive way, such as an enema or into a drip, and they can sometimes be associated with a number of unpleasant side effects. So it's important that a doctor knows if a person's taking any complementary and alternative therapies. Doctors will have different views about them and will tell you different things about them, but they actually need to know whether people are taking them or not, particularly to work out whether they might interact with the mainstream medicine. Because some alternative therapies will actually interact in a negative way with treatments like chemotherapy and radiotherapy and make them less effective. Sometimes, though, there's not a lot of information known about these therapies, and we will sometimes ask people like our pharmacists to do a search of what's known from the literature about any of these therapies so we can give people information about what is really known about them. And there are a number of really good websites that we can refer people to where they can look up any therapy that they might be considering taking to see what the scientific evidence behind them might be.